friends, how many of you would like to more effectively treat yourself or your near and dear ones from muscular dystrophy? Can you type me in the chat box if this is something which is interested for you? Good. So we are on a same page. So how many of you would like to know the means and ways to save money or arrange finances for the treatment while you are doing the treatment from the best of the doctors?
Me, sir.
You, great.
Yes.
We'll answer that.
Yes.
So, friends, first of all, thanks for your time. So we all know that muscular dystrophy is an uninvited complex disease that keeps on deteriorating with time and has very limited treatment options. And we often feel helpless seeing the slow but continuous deterioration of our near and dear ones. The muscular dystrophy as a disease is a really very uninvited and a complex disease, and it keeps on deteriorating with time, and we do have very limited treatment options, and we almost all the time start getting the feeling of helplessness, and due to the continuous and we live in a fear. Nobody would like to see our near and dear ones in a pain. So friends, how many of you would like to seriously come out of these struggles? These are emotional struggles, clinical struggles. Type AMI once more for me in a chat box. Good. So friends, today we are going to discuss precisely the same issues. We are going to discuss the new advancements in technology to effectively treat and manage muscular dystrophy. The first part of the session is going to be focused on the clinical and technological advancements to effectively treat and manage muscular dystrophy. And my friends, second part, we are going to discuss something about money. Many of you shown interest to understand how we can handle that. So in the second part, we will discuss how we can save money, how we can arrange funds if required, and what could be the best strategies for the fundraising, etc. So, friend, in the first part of session, one of the famous name of Western India, who has established mastery and authority in the field of treatment of muscular dystrophy, is going to be with us. That gentleman is having a total experience of more than 30 plus years. I'm not talking about 5-10 years, 30 plus years, my friends. And a specific experience treating muscular dystrophy for almost 18 years. The gentleman, a doctor who has already treated more than 2,000 muscular dystrophy patients by now. He has done his education from the premium of the institutes and trained in the best of the hospitals across the globe. Many young doctors follow him and like to have a dream, or having a dream to become like him. So I know you are aware. So my dear friends, we have Dr. Anand Bagul with us. And on behalf of the audiences, I would like to welcome Mr. Bagul, Dr. Bagul, to this patient awareness program and a guidance program. Guys, please join me to greet Dr. Bagul by writing some messages in the chat box. Welcome, Dr. Bagul. Welcome. Please come onto the screen and say a few words to our audiences.
Hello, my dear friends.
Hello, sir.
Hello, yes.
Hello, sir. How are you? Welcome.
I am fine. Thank you.
So see, Dr. Bagul, how many people How many people are here to have to listen to you, to discuss with you? So thanks, ladies and gentlemen. You are really a wonderful crowd, I must say. And I assure you, on the behalf of MedicoExperts and Dr. Bagal, most of your questions are going to be answered today. Your confusions are going to be answered today. The whole and sole focus of this particular webinar is to make you aware so that you guys can take a very informed decisions and can come out this pain of seeing your near and dear ones from a deteriorating disease. So, Dr. Bagal, shall we start the session? Do you have some words to say to the audience? And then I am having some questions in my mind, which people have shared with us quite a lot. So, if you are having some initial words, please go ahead, and then I will start with some questions and discussions.
Hello, my dear friends. Today we are going to discuss one very important disease, which is very unique and different from the other types of disease, muscular dystrophy. Indeed, it's a genetic disorder. Genetic disorder means that the disease will be progressive, and as the days goes by, the weakness will go by increasing slowly and steady. And mind you well, other conventional treatment do not have got any answer to it. Any kind of treatment you do, the deterioration will be inevitable and slow and steady. This is the biggest problem we are facing, and what we are trying, why we are here. We want to discuss the various aspects of the possible treatment option we are having, so that we can stop the progression of the disease and we can recover the lost power in the upper and lower limb in the child who is losing the power slowly and steadily. So today we start our discussion about this subject.
Great.
Over to you, Neeraj.
Thank you, Dr. Bagal. Thanks a lot. Dr. Bagal, though all of us here know something about the muscular dystrophy, but it's always a pleasure to listen something from I would say, a mouth of kind of person who is an authority. So I would like you to first ask, what is muscular dystrophy for an audiences as a disease? So then I would go to the next questions, like what are the different kinds and all. So what is this muscular dystrophy itself?
Yeah, muscular dystrophy is a kind of disease affecting the muscle in which a genetic defect, which is there in the gene of the cell itself, will cause metabolic abnormality in the muscle fiber, so that the life of the muscle fiber will be shortened and the muscle will go on deteriorating slowly and steadily.
Great. Thanks. So essentially, it's a deterioration of a muscle fiber and strength, right? And Dr. Bagal, why it is a continuous deterioration? It keeps on deteriorating, and the pupil faces very bad quality of life.
Yeah. See, what I told you, the genetic defect in the genes is responsible for the defective metabolism, so that the day-to-day function of the muscle fiber will be defective. The contractile power of sodium pump in the muscle fiber will go on deteriorating slowly and steadily. So as the days goes by, more and more muscle will be affected. They will defective, and the muscle we can witness that the muscle power will go down daily and daily, slowly and steadily.
Understood. Understood. Dr. Bakul, what are the conventional treatments? We typically talk about the advanced treatments, conventional treatments. What are typically the conventional treatments to manage muscular dystrophy?
Yeah, muscular dystrophy is a real challenge for the treatment. The conventionally, what the doctor or other physiotherapists or other rehabilitation therapists do is that they will try to start the exercise, high protein diet, different kind of vitamins, different kind of exercise and physical activity is the only thing they can do. But mind you well, these are having a very limited value. Whatever exercise you try, whatever effort you make, by the vitamins or proteins or any other means, you will see that the muscle deterioration will go on increasing day by day. So effectively, conventional treatment uh, will be having a lot of limitations. There are other advanced treatment now available nowadays.
Advanced treatments, doc. Can we list the advanced treatment? And before we come to the advanced treatments, doc, I also want to understand that if somebody would like to have on a conventional treatment itself, is there any hope in a conventional treatments? Before we
Unfortunately, no. The conventional treatment do not have got much of the hope.
Okay. So if somebody wants to still, because of whatever reasons, want to go on a conventional treatment itself, so what is typical pace of the deterioration, or does the conventional treatment helps in any way to stop or reduce the speed of deterioration? And what is that kind of speeds?
The speed of deterioration, unfortunately, is not stopped by the conventional treatment.
Okay.
For like example, in the DMD, there is a rule of five. Means before the age of 5 years, we don't realize the disease exists. After 5 years, the limping and weakness will start in the lower limb. Slowly, it will go on increasing. At the end of 10 years, you will feel that the walking is very, very difficult and patient is about the wheelchair. By the age of 15 years, patient goes on the ventilator and usually they don't see the 20th year of the life. This is the speed by which the muscular dystrophy or Duchenne's muscular dystrophy, very prominent form of the muscular dystrophy, goes. In these cases, despite of all the effort of the gait training or exercise or muscle building measure efforts, usually do not work and the things will go on deteriorating slowly and steadily.
Understood. Understood. So practically, conventional treatments are not able to help the patients in
Yes,
any
yeah,
particular way. So it's the satisfaction which a family can have that we are doing something, but in practical terms, it's essentially nothing contributing towards it. So this comes to the next point, Doc. What are the advanced treatments? Let's classify what are the options available to us in the category of advanced treatments, and then we'll detail of that.
There are three type of advanced treatment which are available to us as options. One is gene therapy, but this particular gene therapy, due to in vector module or bacterial vector module, is still in a very, very nascent stage, experimental stage, and the result of the gene therapy are not yet established. It is said that a gene therapy will enhance the particular uh, genome defect, but unfortunately, the utility of the gene therapy is not yet established. Now, there now there are few of the uh, now, there are few of the other methods which are also in the picture. Unfortunately, they are very costly, and also the effectivity of such treatment is not much. Hardly you can say 42 to 43% effectivity are there. And as soon as we stop the medicines or treatment, the things will get deteriorated much faster. What we are talking today is about the stem cell therapy using umbilical cord mesenchymal stem cell. And these are the best kind of stem cell by which we can stop deterioration of the muscle fiber and also improve the power of the muscle to a certain extent, say 40 to 50%. But most important is that stopping the progression of the disease is one thing which can be achieved in a great way by using the umbilical cord mesenchymal stem cell. And if you see or if you see the overview of the all the treatment options available up till now about the muscular dystrophy, the umbilical cord stem cell stands a excellent chance of the recovery. Yeah,
So, in summary, you mentioned there is one gene therapy and second is a stem cell therapy. So,
yeah,
what I understood from your explanation, gene therapy is one pretty new in the field and not so established as well as costly. And second, you suggest is the stem cell therapy, uh, which is mesenchymal stem cell therapy. Is that a right understanding, Dr. Bagal?
yeah, definitely, certainly is right.
So, Dr. Bagal, what is your secret? I know I'm asking a very awkward question to you, but
Uh-huh.
your treatment protocol gives success and the results. What is your secret? What do you follow, Dr. Bagal?
Yeah, it's a nice question, I must say. You can understand one thing that if all the genes in the cells are defective, that everyone knows. So if we can use the genetically healthy and strong DNA, good mRNA, these particular then the chance of the regeneration will be much much better in these cases. So secret is using a DNA of a strong genetic composition. In short,
So, I understand it, but I couldn't get a clarity. Is it a genetic therapy you are doing or a stem cell therapy you are doing?
it is akin to genetic, not exactly genetic therapy. It is, sorry, I'm back again.
Dr. Bagal, we lost you in between for 2-3 seconds. May I
Uh-huh.
ask you to repeat it? I'm repeating the question. Is it a genetic therapy or a stem cell therapy which you are
It is
applying?
not genetic therapy. We are not modifying or altering the gene of a patient's own body. We are introducing a mosaic cell therapy by which we are introducing the genes, sorry, the cell and DNA of a genetically healthy individual. They act on. And these muscle fiber which are produced by these genetically healthy DNA will be much more healthier, and not only healthier. The secretions of exome and other compounds will protect the surrounding muscles also. So this you can see some mosaic cell therapy.
Understood. So
Okay, the concept is very new, but it is found to be much more effective by other than any of the available techniques.
I understood, Dr. Bagul, but still I will repeat some part of it so that our audience is also able to clearly. So we mentioned two things. One is in a stem cells, which is I understood is a part of your protocol, and second, exosomes you mentioned, which is also a part of your protocol. So what are stem cells, Dr. Bagul?
The stem cells are the mesenchymal cell, pluripotent cell, which has got a capacity to repair and regenerate a new cell. And this new cell regeneration is a crux of the treatment. Is a treatment by which we are curing the disease. And if this particular mesenchymal cell are of the genetically healthy origin, the cells which are formed out of these particular mesenchymal cells will be much more healthier, and the muscle fiber which are produced by these are much are long lasting, everlasting, and as I told you, the hormones secreted by these cells will protect the other muscle fiber nearby also. So even their deterioration will be stopped.
Understood. So I will take a liberty to explain stem cell bit more in a common man's terms, Dr. Bagul. So friends, what happens is stem cell is typically a basic building blocks of our body. So if I need to share with you the power of stem cells, so when the human body starts getting formation, which is the sperm is essentially getting mated with the egg. The first formation which happens is typically called a zygote, which is essentially a combination of four stem cells. Then in the whole progression of the journey of making a baby, which is right from day 0 to 9 months, these four stem cells multiply themselves and thereafter start taking the shape of the functional cells and the tissues, and that's how they keep on working for continuously 9 months, and the four stem cells take a shape of a baby. So this is a kind of a power of the stem cells which they keep right from a four cells to a baby. So first thing which starts with the stem cells, and this is a similar kind of a cells Dr. Bogle is talking about. And when we say stem cells, they are definitely different kind of a stem cells. Dr. Bogle's main focus is or a protocol is focused on the mesenchymal stem cells, which is really helpful for a muscular functions and the strength. Is that a right summary, Dr. Bogle?
Yeah, definitely.
Great.
We must understand one thing, that the cell within the patient are defective cell with a genetic defect. What we are trying to do is just to cover up the genetic defect in the patient's body so that the muscle will restart growing and will not lose their power and function.
So what are the role of exosomes? You also mentioned exosomes here in your elaboration. So what are exosomes and how they make a difference in the treatment?
Yeah, exosomes are essential ingredients which are derived after the mesenchymal cell, and these particular essential chemicals which are in concentrated form does work in the best way to improve the actions of the stem cell. So that action of the stem cell will much more enhance in a better way and effective way.
Understood. Understood. So they act as a catalyst and speed the whole functionality of the stem cell.
Definitely.
Right. Great. So, is there any in your protocol besides the stem cell therapy? Is other therapies or something else is also part of your protocol? Some supportive
Yeah,
therapy.
yeah. Yes, you are right.
Can we have a glimpse of what could be the supportive therapies along with the stem cell?
Hello.
Someone is on the line.
Okay. I guess my team would put on the mute. It's already done. So let's focus. We will take the
Yeah.
question answers once this basic, because we want to cover the main questions, which are typically the questions I'm asking, what the people have shared. So then we will go to the specific ones. So what are the other supportive therapies, Dr. Bagul, which are part
Yeah.
of the protocol, which helps to your
Yeah,
patient?
apart from the stem cell therapy, as I told you, we are using exosomes. Also, we are using the hyperbaric oxygen therapy. The hyperbaric oxygen therapy is very effective in a way that it will oxygenate all the body, so that the recovery is much better. Also, we are using the ozone therapy, and the hyperbaric oxygen therapy and ozone therapy are supportive therapy to enhance the effect of the stem cells.
Understood. Understood. So, one more typical, I would say, kind of a question for the audience is, Dr. Bagul, is it is it some kind of a surgery or is some kind of a open procedure? It's a mini procedure, it's a injection procedure or a surgical procedure?
Hello, excuse me. So it's only an injection therapy by which the mesenchymal cells are injected in various weak muscles, also in the spinal cord, and also intravenously. So it is only injection therapy. There is no operation, there is no cut, there is no incision, there is no bleeding, there is no stitching. So it's only injection based therapy, and it's very easy, very simple, and patient usually get only injection prick pain, not more than that. And if the patient is apprehensive and is not in condition to receive the injection, we use the short time sedation. This short time sedation is sufficient to cover up the pain of the injection, and will be very convenient for the patient.
Understood, Dr. Bagul. So, what is the time frame when one should expect the results coming out after the treatment?
Usually, it is 3 to 6 weeks for the starting of the first result to come over. But in many of the patients, we see the recovery pattern right from third to fourth day itself. So the first sign of recovery is variable, but usually within few weeks we see the stoppage of deterioration and starting of the muscle recovery.
Okay. So how long does this whole protocol or a treatment process takes? So if somebody wants to come to you and get it done, how many days he should or she should plan?
Yeah, definitely. it takes around 7 to 8 days
7 to 8 days.
usually.
Understood.
And if the patient is non-walking, if the patient is having a contracture in the lower leg, that's why he's not walking. In addition to stem cell therapy, we use corrective surgery under microscopic control so that to straighten the leg, and if we put on the caliper and we can make the patient walk. Even if patient is not walking for 3 to 4 years due to myopathy, we can make him stand and walk and go back to home with a caliper in their hand. In that case, the treatment will be lasting for about 12 to 14 days.
Understood. So to summarize it to the audiences, the typical time 7 to 8 days you can consider for a treatment process. But if somebody who is not able to walk and need a kind of a surgical procedure to strengthening and things like that, so those patients who are quite deteriorated already, the treatment protocol go for 14 days, and it might involve a surgical process also for those, particularly only for those patients where the deterioration has extended quite a lot and the patient is not able to even walk. So what are the success rates, Dr. Bagul, you have observed in your treatment protocol?
In a muscular dystrophy case, the success rate is very, very high. Almost more than 70 to 80% patient will definitely get benefited in much clinically significant way.
Okay.
Yeah, we have seen muscular dystrophy patients who are not walking since 4-5 years. They could be back on their feet and started walking when we went back from our hospital.
Great. So, Dr. Bagul, one more typical kind of a question which comes is, once the treatment is done, is there any kind of a further medication or further therapies or precautions patient need to take after the treatment? Dr. Bagul, are you able to hear me?
Now I can hear you. Now,
So,
about the operative, can you hear me, sir?
Yeah, Dr. Bagul, please go ahead. My
Most
question.
operatively, we will, in fact, we subject them to rehabilitation, gait training, and we take up the help of the physiotherapist, gait trainer at our place. Also, we are in touch with your with a gait trainer and physiotherapist at your place and explained in the letter.
Okay. So I guess we discussed most of the aspects, Dr. Bagul, and now I think there are quite a lot of questions people are willing to ask. But before that, I want to, Dr. Bagul, one of the patient which you have treated, so we got in touch with them and requested them to come here if they are willing. So my team is giving me an input that she's here. So team, can we have Lakshmi, Mrs. Lakshmi, or I'm not sure about the marital status of the Lakshmi ji on the call? Can you bring them on a screen or unmute her? I want to listen to her. So there is a patient who is already treated. She is available and available for 10 minutes, I think. लक्ष्मी जी, आप हैं क्या? Are you there?
Yeah, I'm here.
Great. Thank you, Lakshmi ji. First of all, आप यहाँ पे आए. Thanks a lot for coming here. So, my team gave me a feedback that you have undergone a treatment of muscular dystrophy. So, how was your experience? आपका एक्सपीरियंस कैसा रहा?
बहुत अच्छा था.
तो आपने अपने लिए कराया कि आपके बच्चे के लिए कराया?
मेरे लिए.
आपने अपने लिए कराया. तो आपकी एज क्या है लक्ष्मी जी? 10 years. Very good. So, is it fine? Can I call you beta?
Yeah.
That's it. So, beta, जब आप ट्रीटमेंट के लिए गए उससे पहले आपका क्या हाल था? मतलब किस तरह की समस्याएं थी आपको?
मैं बहुत गिरती थी.
अच्छा, चलते चलते गिर जाते थे. और कितने सालों तक अब तक आपने ये चीजों को ऑब्जर्व किया? 2-3 साल. सो आपका ट्रीटमेंट किसने किया?
महीना.
वेरी गुड. आपका ट्रीटमेंट किसने किया बेटा?
पता नहीं.
डॉक्टर आनंद बागल. ओके ओके ओके. सो योर मदर, आपकी मम्मी आपको पीछे सपोर्ट कर रही हैं, राइट? गुड. तो इफ आपकी मम्मी की बात करना चाहती है तो वो भी आ सकती है. तो क्या असर आपने को देखने को मिला? अभी भी आप गिरते हैं, चलते चलते गिर जाते हैं?
नहीं.
अभी आप चलते चलते गिरते नहीं हैं?
नहीं.
कितना टाइम हो गया आपको ट्रीटमेंट लिए हुए?
1-2 महीने. 1 साल के ऊपर हो गया.
1 साल के ऊपर हो गया. सो 1 साल के ऊपर हो गया. जो गिरने की प्रॉब्लम थी वो पूरी सॉल्व हो गई?
हाँ, थोड़ा थोड़ा है. फिर साल हो गया.
1 साल हो गया. सो बेटा, आपकी मम्मी आपके साथ हैं क्या?
हाँ है.
गुड इवनिंग सर.
थैंक यू मैडम कमिंग. तो बच्चे ने बताया 1-1.5 साल हो गया है, 1 साल हो गया है और गिरने की प्रॉब्लम
1.5 साल हो गया सर.
1.5 साल हो गया. वेरी गुड. तो अभी कोई प्रॉब्लम आती नहीं? तो आप
अभी थोड़ा प्रॉब्लम है सर. पहले श्वेता मेरा बेटी का बार गिर गई थी सर.
अच्छा.
अभी थोड़ा इम्प्रूवमेंट है सर.
वेरी गुड. अभी गिरना बंद हो गया?
क्या?
अभी भी गिरना बंद हो गया?
हेलो.
अभी भी बेटी गिर जाती है क्या चलते चलते?
हाँ, चलते चलते नहीं सर, बिल्कुल नहीं.
वेरी गुड.
अभी बिल्कुल नहीं सर.
तो जब आप डॉक्टर बागल के पास गए तो मन में कुछ डाउट थे क्या आपके कि मैं डॉक्टर बागल के पास?
मेरा बेटी को पहले का चढ़ के ऊपर उठने का नीचे वो बहुत मुश्किल है सर. अभी थोड़ा इम्प्रूवमेंट है.
गुड. तो आप सेटिस्फाइड हैं ट्रीटमेंट से?
या सेटिस्फाइड.
थैंक यू मैडम. थैंक यू फॉर कमिंग हियर. मैंने क्यों सोचा कि आप आए, क्योंकि कई बार ये होता है कि जो एक्चुअली ट्रीटमेंट कराता है ना, हमारा ये रिस्पॉन्सिबिलिटी होता है कि हम उनसे भी बात करें और समझने की कोशिश करें. तो थैंक्स अ लॉट आप यहाँ आने के लिए.
ओके
तो आपका टाइम निकालने के लिए मुझे बताया गया कि आपके पास 10-15 मिनट के लिए आप आ सकती हैं. तो थैंक यू. थैंक्स फॉर.
थैंक यू.
So, Dr. Bagal, we are starting the question and answer sessions, and I'm sure there are many questions which are there. So, shall we start? And friends who have not put their questions into the Q&A box, please keep on putting.
Yeah, before that, I want to talk about Lakshmi. Lakshmi was a 9-year-old child, very sweet child. When she came back, she was a lot of unsteadiness and repeated falling. अब क्या होता है ऐसे? See what happens. These kind of disease, the progression or deterioration is rapid and progressive. ऐसे बच्चे में डिटोरेशन काफी बढ़ जाता है दिन ब दिन. बट अब आप देख सकते हैं कि स्टेम सेल करवाने के बाद he has stopped deteriorating, number one. And second thing, the truncal balance has improved to a great extent that the frequent fall are now much less. And as the days are going by, she is getting better and better.
सर मस्कुलर डिस्ट्रोफी है, LGMD2 है.
मस्कुलर डिस्ट्रोफी है,
LGMD2 है.
LGMD2. Dr. Bagal.
Okay, right. It's a common form of muscular dystrophy, definitely. And
So can you
certain,
speak in Hindi? Can you speak in Hindi?
yeah, LGMD एक मस्कुलर डिस्ट्रॉफी का बहुत कॉमन सब टाइप है।
हाँ जी, हाँ जी।
और ऐसे में क्या होता है कि लिम्ब गर्डल यानी शोल्डर मसल, हिप मसल और स्पाइन की मसल, इसमें डिटोरेशन आना शुरू हो जाता है।
बिल्कुल बिल्कुल।
ऑब्वियसली एज यू नो ये जेनेटिक डिफेक्ट की वजह से होता है। एंड ऑब्वियसली एज आई टोल्ड यू प्रीवियसली, ये जेनेटिक डिफेक्ट है। जैसे दिन जाते हैं वैसे धीरे धीरे अपना असर ज्यादा दिखाना शुरू करता है। ऐसे ही लोगों में स्टेम सेल का अगर सही तरह से इस्तेमाल किया जाए एंड जेनेटिकली स्ट्रॉन्ग स्टेम सेल आपके वीक मसल में हम इंजेक्ट करें तो इसके बाद डिटोरेशन स्टॉप होना और इंप्रूवमेंट होना आपको धीरे धीरे नजर में आ जाएगा।
तो मेरी 30 ईयर्स है ये, जब ये 30।
या एलजीएमडी ये मिडिल एज की ही बीमारी है। ये 15-20 साल के बाद ही शुरू हो जाती है।
My 7-year-old son is diagnosed with DMD from last 1 year. Dr. Bagul?
ओके या डुशेन्स मस्कुलर डिस्ट्रॉफी जो है, मस्कुलर डिस्ट्रॉफी की बहुत कॉमन बीमारी है ये, जिसमें जेनेटिक डिफेक्ट जो रहता है जीन नंबर 48 to 52 इसके एक्सॉन जो है इसमें जो डिफेक्ट आ जाता है, जिसकी वजह से डिस्ट्रोफिन की निर्मित काफी कम हो जाती है। इसमें भी अगर जहां जहां मस्कुलर डिस्ट्रोफी या मसल वीकनेस आ जाता है, जैसे ग्लूटिया, क्वाड्रिसेप एंड मोस्ट इंपॉर्टेंट इन द काफ, इसमें अगर हेल्दी मेसेंकाइमल सेल का इस्तेमाल किया जाए बाय मल्टीपल इंजेक्शन, जैसा मैंने आपको पहले ही बताया है, ये बीमारी हम रोक सकते हैं। ना सिर्फ रोक सकते हैं, इसमें इंप्रूवमेंट भी ला सकते हैं। और जेनेटिक डिफेक्ट में एक है डीएमडी में, ऐसे बच्चे यूजुअली 15-20 साल के आगे उनका लाइफ स्पैन नहीं रहता। बट हमने जो पुराने डीएमडी के पेशेंट जो ठीक किए हैं, 2-3 पेशेंट की उम्र है वो 22 साल की ऊपर चली गई है, अभी भी वो चल रहे हैं, घूम रहे हैं डुशेन्स मस्कुलर डिस्ट्रॉफी होने के बावजूद। सो डीएमडी है तो चिंता की कोई बात नहीं है, डेफिनेटली हम स्टेम सेल द्वारा आपकी सहायता कर सकते हैं।
Great. So, I hope we have answered your question. If something is left, you can put in the chat box. We'll come back. So, I'm moving to the next one. Kushal Agarwal. My wife is having muscular dystrophy, lumbar girdle. We have 4-year sons. I am tensed that my son will also have the same issue? So what is the probability that this genetic disorder will pass to the next generations? And the age of the wife is 30.
It's a nice question. LGMD muscular dystrophy जो है वो unfortunately can be passed on to the next generation, for which we can do one thing. हम इसका ब्लड टेस्टिंग करवा, बच्चे लेडी का ब्लड टेस्टिंग करवा सकते हैं। इतना ही नहीं तो हम कोरियनिक बायोप्सी के द्वारा हम ये फैसला डिसाइड कर सकते हैं क्या अगले आने वाला बच्चा में एलजीएमडी की बीमारी है या नहीं होगी। इट्स एडवांस टेक्निक बट नाउ इट इज अवेलेबल।
So Agarwal ji, I hope your question is answered. Do you have any further clarification do you want on this? Okay, if you are still having, you can type your question in the chat box. We'll take it up. So there is a question from Abdul. From who the stem cell will be taken? What is the source of going to? What is the source of the stem cells? What would be the source? Is the question.
The source of the stem cell is a umbilical cord of a cesarean section child in a strict aseptic precaution of a healthy mother, checking her all the blood profile. That is a healthy mother without any infection profile and without any of the genetic or any of the other disorder. That particular host is taken in consideration. So that water cells we are having are the healthy, robust, genetically strong, infection-free, and very active in repair and regeneration.
Thanks. I hope your question is answered, Mr. Abdul. So Gaurav, we spoken earlier. His question is are you available in Delhi? I guess I can answer. this question, Gaurav, you need to plan to come to the Pune for this particular treatment. So,
The doctor available in Delhi?
No, you need to come to Pune. Please give me the right name of the method. So, Abdulji, it's the mesenchymal stem cell therapy.
Yes, yeah, definitely.
Then, what's the name? From Sarwar. Cost of the treatment provided by the Dr. Saab and the duration of the treatment. With respect to cost, we are going to talk about in a later section of it. The duration of the treatment, definitely, Dr. Bagul has clarified 8 to 10 days if the mobility is not restricted. If the mobility is restricted, it may go up to 14 days. And then, Ahmad ji, I am from Pakistan. At the moment, I can walk but unable to climb stairs. The disease has affected me lower girdle, but the progression of my disease is not significant. I'm 40 years old. Is there any hope for me, Dr. Bagul?
Yeah, definitely. It's a milder version of the LGMD, most probably, and we can definitely help him. Sure.
So, Ahmadji, there is definitely a hope, and you should look forward to get it early, because by the nature of this disease, it's a continuous deteriorating in nature. It's good that your deterioration is not so fast, but plan as soon as you can. Again, there is another question from Mr. Ahmad, Shabir Ahmad. Sir, muscle dystrophy hai. I am belong to Pakistan. What are the total expenses? Expenses के लिए अगले वाले सेशन में भी बने रहिए, and the team would be able to help you out the more detailed one, because it's typically varies from patient to patient. This is Fami. I'm 36-year male from USA with both weak knees and both ankle joints due to muscle deterioration from repetitive muscle injuries for 8 years. It is so bad that it looks like LGMD, even though it began as a purely traumatic injuries to the knees. How many treatments and how many days should I plan for each session when I come to the Pune? Can you give also me the idea of the cost? So
it's a very atypical case. So before labeling as a muscular dystrophy case, we must investigate the case very properly. He must send all the reports with him, especially EMG and nerve conduction study and the various enzymatic level of the blood to us. So we can just study everything and we'll get back to you. So your case need different special evaluation for the further treatment protocol.
So my team will guide you how you can take it forward. But as Doc has mentioned, then a specific investigations to zero down what should be the kind of a protocol would be required. And accordingly, the cost and other things can be worked out, including the duration of the treatment. So you can definitely be touched. And we do have some specific information with respect to the cost and the money aspects after the clinical questions. You may like to stay up to that point. So next question is Shabir Ahmad. Kindly guide me about the way of treatment, procedure, time and expenses. Please stay with us for a while. You are definitely going to get all the information. So next question, any pre-treatment that I confirm this is a muscular dystrophy, and this is I'm not able to read the name clearly, but okay, let me generalize the question, Dr. Bagul. How one can ascertain that this is the case of muscular dystrophy? What are the diagnostic tests to zero down that it's a muscular dystrophy case?
We can do one thing. We can check the EMG, electromyography, nerve conduction study, various enzymatic level like CPKMB and aldosterone, alkaline phosphatase, and other blood titles. We can always go through that, and we realize what kind of disease that is and to which extent it has been progressed up till now.
Okay, thanks. So there are diagnostic test fronts whereby you can get confirmed that it is the muscular dystrophy as a category or something else. So which Dr. Bagul has already explained. So I'm moving to the next question. This is from Amir. My son, aged 24 years, having muscular dystrophy. Can it be cured? How long it will take to recover? And there is a question of a cost which will take it further.
Muscular 24 years means either it can be Baker's muscular dystrophy or LGMD. We need to first diagnose the case, what subtype of muscular dystrophy patient is having, and we will definitely give him a proper advice and proper treatment to relieve his particular problem, what he is suffering from.
Understood. So, Dr. Bagul, I have a indirect question coming out of this. So, muscular dystrophies are of different types. So,
Yeah.
is there any kind of a muscular dystrophy which is not treatable, at least by you?
In fact, difficult to say. Very difficult to say.
Which means you are able to handle all kind of muscular dystrophy.
There are few of the fulminant muscular dystrophy which deteriorate very fast, and a few of the muscular dystrophy which are very, very mild in nature. Obviously, these are not up to the treatment mark. We can leave that. Not issue at all.
So, Mr. Amir, in general, it's treatable. However, to understand the subsequent steps, we need to understand the case a bit more with respect to the subcategory and things like that. And accordingly, the next questions like how long it will take to recover, etc., can be answered. But in general, it is treatable. So, the next question is Santosh Sham. Sir, I have Becker muscular dystrophy. Is there any treatment for that? If I get any cure in future, and if I get cure treatment for BMD, it completely cure. Can I walk properly?
Yeah, Baker's muscular dystrophy is a milder version of the Duchenne's muscular dystrophy. The genetic problem is same. 48 to 52 number of genomes are defective. The course and pattern of the Baker's muscular dystrophy is similar to Duchenne's, but in a very milder version. Usually, they have got a relatively long span of life, and working also. They can work with a lot of difficulty till the middle age. Even in these cases, the multiple injections of a mesenchymal cell in the defective muscles can definitely improve their quality of their life.
Sure. So, in summary, yes, Becker muscular dystrophy can be handled. It's treatable. DECME from 48 to 52 exon. Abdulji, I guess you need to write it bit completely.
Right.
Because this question, Dr. Bagul is not looking completely. DECME from 48 to 52 he had read exon. Are you able to understand what he's trying to ask?
These are the genetic defect in a chromosome number 48 to 52.
52.
You can narrate in that way to make it simple English terms.
Similarly, Ajay Gargji also written DMD exon 49 to 55. So precise chromosome number. He is in walking condition. So Ajayji, we can definitely treat him. So not an issue. And we'll discuss how you can get in touch and can understand in precisely how the treatment goes. There is going to be a process of, we will have an online consultation whereby specific questions and a specific treatment protocol. What I can share with you in general that these protocols are particularly the number of cycles, what is the kind of a dosage. It depends on patient to patient. There's nothing like a very standard. These are the customized protocols which are created for the patient. So it's going to start with an engagement where one-to-one consultation my team will arrange with Dr. Bagul. He will go in detail with the case and all this information like what are the genes and the chromosomes which are affected, what is the severity of the disease, what is the current situation. On the basis of that, the treatment protocol is ascertained, and thereafter, the cost and duration is typically determined. So, Amirji has one more question. Up to 3 generations, we have no such problem from both father and mother side. How my son got this problem?
Yeah, it is called a mutational defect. The mother is healthy, father is healthy, but during the process of the zygote formation or ovum formation, the genes genes defect will get genes will get damaged, and the defect is produced. It's called as mutational abnormality of the genes. It's unfortunate, but it stands true.
Understood. So he has written one more statement. What is synthetic stem cell? Have we discussed anything on a synthetic stem cell?
He must be referring to the exosomes.
So there is nothing as a synthetic stem cell we have discussed, Mr. Amir. I guess we discussed about the mesenchymal stem cells. So either you can reframe your question or perhaps it's a wrong understanding. Then Santosh, can get cure treatment? The question is the muscular dystrophy is going to be cured completely, or it may require some future repetitions, Dr. Babu?
Thing is that we can give the one section of the stem cell initially. The usually effect lasts for say around 1 year to 3-4 years. Once we realize that the deterioration has restarted, at that time we can again give the boost up doses of the stem cell. At that time, when the defect has restarted again. So when the deterioration restarts, give the booster dose, and that will solve the problem.
So the summary, the first target is to stop the deterioration, and the deterioration will stop. There might be a chances for few cases in future, let's say 5 years, 6 years, 10 years, that deterioration may start. And answer to your question that at that point of a time, a booster dose might also be required.
Yeah, about 70% patient, the deterioration never comes back. But in 30% patient, the deterioration may restart again after 3-4 years. At that time, we can just give the booster doses and the problem will get solved once again.
Sure. Thanks, Dr. Bagal. Next question is from Abdulji. His question is, does the frozen placenta give more chances? So the mother will give the stem cell?
Unfortunately, no.
So as Doc has already mentioned that these are the placental is, I guess, very different terminologies. Would you like to comment on placental stem cells?
Yeah, placental stem cell and umbilical cord stem cell has got the same generic. So there's no much difference in the both quality of the stem cell will be almost similar.
Sure. So there is a question from Ajay ji. Can you speak in Hindi? I guess it's difficult because there are also the comments who are saying that you speak in English. So if you are having a specific question, we'll try to answer that in Hindi. But in general, we are having international audiences also here. So the preferred language is English, but we would not shy away to answer your question in Hindi. Next question is Jayesh. How to determine which kind of a muscular dystrophy one has?
It depends on the clinical feature, what feature patient is presenting with, which kind of muscles are affected in the particular individual, and the pattern of the disease, which determines, which we can guess the kind of the muscular dystrophy the patient is having. If the patient start getting the weakness at the age of 5 years with a hypertrophic calf, the calf undergoing a hypertrophy, then it is a little more likely to be. We can have a judgment as per the clinical picture and pattern of the disease.
Understood. So there is one more. Mr. Abdul is having a confusion in mesenchymal. Team, can you write in a comment box the right spelling of a mesenchymal stem cell? I guess his question would be addressed by them. The next question, can you scroll it? For whom the stem cell will be taken? Again, Abdulji. So here the answer, I guess it is already answered. So I'm responding on the behalf of Dr. Bagul. See, it's from the bank, right, Dr. Bagul? Stem cells are going to be taken from the bank.
Yeah, similar to that. Right.
It's not any specific individual. It is going to be based on your parameter and a best match basis. There is the banks of the stem cells from where the stem cells are going to be taken, and for the process, then mesenchymal stem cells are going to be applied. And my son's 48 to 52 exon, I guess we discussed already this. That's manageable. Dr. Adarsh, I am Adarsh, 55 years, male. Myopathy, male GNE myopathy. What will be the prognosis with stem cells therapy? Is it infusion or a local site injection?
It will both infusions as well as the local site injections. Both of them, both has to be used in your case.
Then what's the name? Ganesh. What all reports do you require to identify gene therapy?
Pardon?
What all reports do you identify gene therapy? Ganesh, we are not talking about the gene therapy. I guess you need to rephrase your question, or I guess there is something wrong understanding. It's the stem cell therapy we are talking about, not a gene therapy. Hi, sir. My son, 14-year-old, suffering from muscular dystrophy such as mitochondrial myopathy with secondary lipid accumulation, left first us lateral muscles biopsy. Is there a treatment for this, Dr. Bagal?
The mitochondrial muscular dystrophy is a very difficult disease. It not only affects the muscular dystrophy, it also affects the neurons and other important vital organs also. It's a very difficult disease and very difficult to treat, you can say. So mitochondrial muscular dystrophy is a very difficult to treat. It needs but we can definitely evaluate your report. If the patient can send me the report, I'll give all the complete evaluation. I will study all the report. Not only you need to send me the muscle related report, but also other report of the like MRI of the brain and other relevant report. So I'll go through, we'll get back to you. It's a difficult disease. Mitochondrial muscular dystrophy is a difficult disease to treat.
So, Madhu Kumarji, I guess the simple answer is not there. We need to evaluate further before we can confirm. So, Abdulji, specific treatment plan we discussed, it is going to be based on one-to-one consultation. Madhu Kumarji, once again, if there is a treatment, how can get the treatment? So, my team will help you how to get a book an appointment. We'll evaluate the case. If there is anything possible which we can do, we'll not shy away to do it. But it's a difficult case in nature. Abdul, when the doctor spoke about 48 to 50 in Hindi, what he meant. So what he said is it's manageable, and you can move to the next step whereby we can go for one-to-one consultation and identification of a treatment protocol for you. Aruna Asma, my son is 10 years old, which he has a muscular dystrophy disease. We have done the treatment of stem cell in Bombay, but there is no improvement in it. So please, can you help it out? So, Asimaji, where you have done it, I guess this is one. Dr. Babul, we need to do something about some practices here. There are a few people who are perhaps doing something with the name of a stem cell, and patients like Asimaji is struggling then.
Yeah, I agree with you.
So, can I say something? One to Asimaji, I guess you can share, you can be in touch and share the reports and what is done. I guess we need to understand it, and then we can answer in yes or no, or very categorical deterministic terms. But friends, I would like to definitely say something. See, there are some kind of treatments which are very personalized treatment, like the stem cell therapy. And these are the treatments which are, the results depends quite a lot based on who is doing it. So they are not like a very standard kind of treatments like paracetamol. If you take, it's going to reduce your temperature consistently irrespective of whom you are giving. So my serious suggestion to you, my friends, the protocols or the treatments which are research based, right? Not very standard protocols that anybody and everybody can do it. You must be in a very good hands. Please don't take chances by tall claims, go with do good research and things like that. But these are the treatments you must take from a good hands. Right. So that my in general suggestion to all, because I frequently hear such kind of I would say experiences from our people, and when try to decode that, we couldn't find the answer why the person was at some center where there was no track record of the results. Anyhow, so we are moving forward. C. Singh, can 45 exon deletion DMD age 4 years can treat by stem cell?
Yes, definitely.
The answer is yes, Mr. C. Singh. Mr. Ganesh, which report do you need to decide on a stem cell? So the question is, let me generalize the question. What are the typical reports one should get ready with if somebody wants to have a consultation with you? So what they should come with for stem cell therapy?
Right. Yeah. If you are talking about the muscular dystrophy, person should have a report of the EMG, nerve conduct study, various other blood parameter patient is having, like CPKMB, aldosterone, alkaline phosphatase, and if the DNA analysis is there, and other relevant report, what he is having, he must present to us during the consultation so we can definitely analyze the case in better way and give the proper answer or treatment protocol.
Okay, and my team is also going to assist you, so you can get in touch and you will get the details also, or the number from which you get the information about this webinar. You can also ask the questions there, and the team will assist what reports you should and help in appointment as well. Mr. Femi, I'm sure is Mr. or Mrs., but Femi is a. Have you had some patient with limb girdle muscular dystrophy type 2A in the past?
Yeah, it's one of the commonest type of the muscular dystrophy. What
so
we are
big yes, Femi, big yes, not a small yes, big yes. Many patients. Amsa, where I can share the reports. I just mentioned Amsa that we are going to share the contact details where you can, as well as all the other the common MedicoExperts number. Team, can you put the numbers in a chat box so that we can answer all the questions, the common number where people can get in touch and move for the next processes. The next question, Abdul, did the doctor treated boys? What was the results? See, this, Mr. Abdul, the human body is, or muscular dystrophy is not gender dependent. So, Dr. Babu, would you like to say something? The question is, have you treated boys, and is your therapy is going to work differently for boys and girls?
what?
So I guess the smile is sufficient enough. So treatment is treatment, it's not gender dependent. So is there any other questions? Is your treatment recognized by medical fraternity? That's a good question.
Yeah, it's a very good question.
So Ganesh is, and I'm sure this must be the question of many others. And this is typically a really good question and a serious concern of the patient, Dr. Bagul, because there are certain treatments which are so-called ICMR approved and things like that, and they're few in a research phases. So what you would like to say about this when Ganesh is asking, is this recognized by medical fraternity?
Yeah, it's a very good question, I must say. When we are talking about the muscular dystrophy, if we see the various the treatment option available up till now with us, few of the standard treatment, we have discussed it already, that the standard treatment of exercise or rehabilitation, gait training are having a very limited utility. That as soon as we stop the particular therapy, the thing will get back to square one. Not only that, despite of continuing this therapy, the deterioration will continue, as we can say. So in fact, you can say that muscular dystrophy is such a disease where there is usually no answer for that. We are trying to search for the various kind of answer. And what are the treatment options which are available up till now? We are trying to explore which kind of therapy is based for this muscular dystrophy. So out of which it was definitely well recognized by everyone that the mesenchymal stem cell therapy is one of the best treatment to treat the muscular dystrophy. So that as it is, they don't have any of the bad effects, side effects, it definitely improves the clinical, improves the condition and stop the deterioration of the disease instantaneously. So that what we are using is a kind of treatment, though it is in the clinical research phase, but it is the best treatment ever available for the muscular dystrophy at present.
Further, I would also like to, Dr. Bagul, add something here. So the specific, I guess we guys are always known for absolute transparency, and all the attendant people who are in this webinar should understand that this particular stem cell therapy for muscular dystrophy is in research phases. And this is precisely the reason why you should be in a very good hands. Okay. Second point. See how this approval process works, that also you need to understand. Whenever a new research reach to a very advanced, stabilized stages, where every and any doctor can practice it, then it reaches to the stages where there are approvals like FDA approvals, and somebody has written FDA, somebody's ICMR approvals, or DGCA approvals. So it's not like that the healthcare is not improving. Healthcare technologies is not improving because it's a progressive word. If every doctor is going to practice what is that it is written or approved by the ICMR, then there is not going to be any growth into the healthcare sector as a technology, as a new advancement. So both of these things goes hand in hand. Having said that, there is no bar, there is no restriction by any of the healthcare organization on these practices. Approval in the field of stem cells, if I need to answer you, what is the approval stage and what kind of a treatments have reached to this one? Application of stem cells in hematological disorders like cancers, blood cancers, sickle cell anemias. Yes, that's already approved. Very recently, I guess few months back, application of mesenchymal stem cell or one product of mesenchymal stem cell is approved by DGCA. And the ortho disorders like avian and all, it's also now in the category of approved. But for muscular dystrophy, it's still in research state. And this is very, very precisely the reason that you must be in a very good hands. Don't take a chances going here and there. The researcher who is able to give a good result to you should be the one you should count upon. And second is one more important factor you should definitely think. See, what is at the stake? What is the other options do we have when we are fighting against a disease like a muscular dystrophy? Is there any other option? Then what if their particular treatment, which is in a research state and there are few researchers are able to give some good results, which are verified results. The patients themselves are coming to now open forums and speaking about it. But yes, that is one more thing, that since it is not in a very advanced stage and a replicable mass manufacturing stage, you should be definitely in good hands. And the question was, Dr. Bagal, stem cell therapy treatment options are done in later stages or earlier stages? When a patient should think, I should meet Dr. Bagal?
See, you can say that there is a dictum in English or Hindi. A stitch in time will save 9 stitches. It's always say, if the treatment is done earlier, it's better, it is always easier to prevent the further deterioration. Once the power is lost, it's very difficult for it to come back. It does come after stem cell, but it takes somewhat of difficulty. So that whenever there is a power still present, it's better to preserve the power by using the stem cell as early as possible. So earlier is always better.
So answer is any disease, sooner the better. You might be getting unnecessary complications by ignoring it. So any other questions? Which cell is used in DMD? It's already answered. I'm repeating, mesenchymal stem cells. Yash, has Dr. Bagal treated any LGMD to a patient?
Okay, yes.
Answer is yes. Your next question here, if yes, it is possible to meet the patient. See, in medical fraternity now, those who are very standard organizations which are NABH accredited, we do have the responsibility to protect the identity of the patient. For example, tomorrow if you are getting treated with us, if somebody wants to meet to you, we can't simply ask the people to go and give the phone numbers of yours to any others. So the better way is, whenever we do some kind of events like this, we definitely invite few patients, and few patients come voluntarily. But it's very unfair for me or any structured organization to ask any patients or reveal the details of any diseases, any patients. We are bounded by the confidentiality clauses with respect to patients. So it's a bit unfair kind of expectation that you want to meet with another patient. However, there are few people sometimes give on of their own voluntarily some kind of a words or testimonials, you can say, or come to the platform voluntarily. They are all welcome. But this request is very difficult to, I would say, against the ethics of a medical fraternity, that I'm going to give you the contact details of another patients. So sorry on the second part of it. So last is that I do agree what you said, where we are not rich, any Dr. Bill. I do agree in all what you said. So as far as this financial part, Mr. Abdul, I guess once the clinical questions are answered, we'll try to take them. There are multiple ways you can there. Question answer round. Do we give anesthesia when putting the injections?
Yeah, I will answer that. Nowadays, anesthesia is not per se required, but we have got a beautiful sevoflurane mask method by which under the anesthetist gives you the mask gas sevoflurane. The child will be sleeping immediately after putting on the gas, and as soon as the procedure is over, we can take out the mask, and within 5 seconds, the child will be again wide awake and sitting on the operation theater. So the risk of anesthesia is virtually minimized to zero after using the anesthetist workstation with a sevoflurane in the picture. So medical science is getting very advanced day by day, safe and very effective, and totally risk-free.
Understood. So there is one more comment, I would say, rather than a question by Mr. C. Singh, whereby he's saying AIMS Delhi refused to take stem cell therapy. So as we already mentioned that this is particular treatment or a protocol which is in a research stage and few researchers are practicing it. It has not reached to the mass stage where every doctor is practicing it. So what you're saying could be a right possibility. Is any cure for a BMD? We have answered it yes, absolutely yes. You can move forward. If get cure treatment in future, it will completely cure and I walk properly. I'm 28 years. So if I get cure treatment, so how would you like to answer, Dr. Bagal, this question?
Yeah, we will definitely try our best. What a possible way we can help him. Either we must get training or defaulty correction that we always have to look out. And definitely the stem cell will definitely help to improve the power. Once the power of the legs will improve, and when the joint control will be better, then the things will be much easier for the patient to stand, walk, and conduct his usual daily routine. We'll try.
So the nature of a disease is everybody can do its best, and this is what you can expect. Abdulji, it's a repeat question, and yes, the stem cells are from the bank, not from the patient itself. So here we conclude there are no more questions to be answered, Dr. Bagal. So I would seriously like to thank you, Dr. Bagal, for spending so much of our time with our wonderful audiences, and they're so exhaustive questions. I'm seriously impressed by the interest the audiences has taken today, and thanks for your support, patience, and answering them very thoroughly. Thanks, Dr. Bagal.
Okay, thank you everyone. Thank you all the audience.
So guys, if you want to carry forward this discussion with Dr. Bagal and want to evaluate your particular cases on a one-to-one basis, my team is going to put the details how you can be in touch with us, and my team will ensure that you are able to meet and interact Dr. Bagal on a one-to-one basis, where you can discuss absolutely your own case. In sessions such like this, we can take the generic questions, more of a generic questions, more of a sensitive questions. We are happy to take sensitive questions which are applicable for a broader set of pupils, but it's difficult to take one-to-one questions in the sessions where more than 30 patients are there, and it doesn't, we don't also feel comfortable to give some personalized information. So we respect the confidentiality and of the patients quite a lot. So one-to-one session, you can go as detailed as you want. And there is one more question. Please answer once again. What is that? Yes, Becker muscular dystrophy, we can take it up. The answer is yes, Mr. Santosh. and you can be in touch with the team, and we can take the discussion further. So thanks, Dr. Bagal. All the questions are answered. So I also planned some session on financials related questions with the audiences. Let me check. In the meantime, Dr. Bagal, if you want to resume your patient's work, you are free to do so. I will spend some more time with the audiences, try to understand if there are any financial issues, and planning the medical experts can help. So thereafter we'll conclude, but you can definitely take a leave.
Okay, thank you everyone. It's so nice talking to you.
Thank you, Dr. Bagal. Thank you. So guys, now the next question is on a financial part of it. So I just want to understand that let me share what is the next way forward. See, it's repeatedly said that the exact treatment protocol is going to happen after a one-to-one consultation with Dr. Bagal, and my team is going to assist you during the whole process. The contact numbers are circulated once again, and I'm sure you must have got some messages from a centralized MedicoExperts number. You can also send the messages there, and you will get the support. So next question, I noticed that there are a few of the audiences which has left. So first part, how you can get in touch further is already answered. The numbers are published once again. Second part, how many of you want to understand the financial aspects? The ultimate cost of a treatment you would be able to get to know after one-to-one consultation for sure. But at the same time, financial strategies, fundraising, how many of you would like to understand that? Can you please respond on a chat box? 1. Ceasing 2. Family 3. So guys, what's your, there are multiple aspects of when you say financial strategies. Is it fine? Would you like to have this interaction one-to-one basis, or can I answer it in a broader audiences? Can you please give me a feedback? Want to know about crowdfunding. See, broader first. So initial days when we used to look for the funds, then the typical approach used to be the family and the friends, and sometimes governments also supporting, sometimes employers supporting, and this used to be very limited scope. But these days, I guess Mr. Singh has rightly said about the crowdfunding is actually the right way to go for it. The reason being, it's very simple to ask $10 from 100 people or 100 rupees from 100 people, but it's very difficult to get from one people 10,000 or 1 lakh rupees. So this world of fundraising has changed quite a lot. And the conventional ways of fundraising, when we used to approach to the family.
Alert from no backups for 15 days.
From the family, from the employers, where we used to count over hundreds of thousands of a dollar or lakhs of rupees from one or two individual, is impractical these days, unless and until that person is very close to you, emotionally connected, and there is a win-win situation for him to do so. You would be able to get it, but very difficult. The success rates are very, very low for that. But the crowdfunding is the way to go these days. And there are challenges in crowdfunding also. How do people believe you that you are seeking a fund for a genuine reason? Because there is an exploitation in crowdfunding which has also started happening. Earlier, the people used to generously give for a crowdfunding. Now they are getting suspicious because people have started even misusing them. So for a crowdfunding, the right way is that you need to have a very authentic documentation supported by a very authentic organization that this is particularly their treatment plan, this is the expenses, this is the financial status of an individual, and what are the challenges you are feeling, that has to be certified by some credential organization, and it has to be supported and to be put forward in some platforms where the people can see how much the fund is already raised, what is the deficit. Even you can send it to your friends and families and your communities, and they will start supporting you by seeing the gaps, when they are able to see the transparency, when they are able to see the genuine cause. So that's how the crowdfunding happens. Otherwise, it's very difficult for you to approach 100 people, 1,000 people to raise few lakhs of rupees and things like that. But it's very simple if you do it in a very correct way, which means very, very authentic certification, and the organization like MedicoExperts, which has trusted quite a lot. But be assured that we are also going to do a good level of due diligence before giving any kind of a certification that this is the case, this is the requirements, and all such kind of things. Yes, we support few of such kind of cases, but crowdfunding is the right one, right set of a documentation, authentication from a trustful organization, a right platform which can help you to generate the funds, and you can also circulate within your community, and that's respected. That's how this funding problem is solved these days. And at least we are very fortunate enough, with the grace of a God, that wherever we supported the people, and they are successfully able to gather those funds. Is there any question beyond that you want me to answer? So guys, my suggestion here is, because I also realized in my previous experiences that this one-to-one people are more comfortable. If we manage amount by crowdfunding, then it is taxable or not? No, it's a crowdfunding. So the donors are typically able to get some benefits, but the way it works is the organization or a platform which is managing the fund for you will directly pay to the hospital, not to you. So it will never reach to your hands. It will reach directly to the hospital, and you are not going to be taxable for that. So friends, you can always come. Who will handle it for me? I guess that totally depends upon, you can get in touch with the team. Let's try to understand that. There are multiple factors on the basis of which the answer can be given, and the team will guide you appropriately. So the friends, I guess we have already spent more than 2 hours, and the time is already allocated time is gone. Femi, cost of coming to India for treatment and living cost in Pune. Femi, my suggestion is my team is going to help you in detail about these particular aspects, and will help you to ensure that you are getting your accommodations done as per your budget and travel, and so my team will help you. So yeah, Abdulji, you can be in touch with the team. So guys, the time is over. Although I planned few more things, but with the candid session which we had today, time is pushing us. You can be in touch with the team definitely, and you can expect all the support from the MedicoExperts and the best results from the Bagul in days to come. And this is our passion as a MedicoExperts, to work out different treatments which are not conventionally available. And MedicoExperts, even out of a country, we are moving outside and doing surgeries, procedures in African countries and different ways. But India, our passion is typically to identify all those good works which our people are doing, and can help the peoples facing a different and difficult situations. Thanks, guys. The numbers are once more published. I hope you enjoyed the sessions. Be in touch.